The latest on COVID in Idaho now. The state is starting to see an upward tick in daily case counts and increased community transmission. Hospital capacity remains in good shape, but with people excited for a slate of summer events, medical experts are reminding communities there is still a high spread of the virus. News Channel 7's Joe Paris joins us in studio now for a look at current COVID conditions and what experts are saying. Joe?
Well, Doug, we know that there is COVID burnout across the state of Idaho and really the country and the entire world. It's as a result of living the last few years with the pandemic, and some, because of that, are hesitant to get back to things like masking and distancing. And experts know that people are burnt out. How could they not? But they still want people to know what they're dealing with, and they're hoping they'll listen to expert advice. Now, this map from the Idaho Department of Health and Welfare reflects the transmission levels across Idaho. The red you see is high transmission, and the red area right now includes Ada, Elmore, Valley, and Lewis County up north. The vaccine rates are also something that we're talking about here in the state of Idaho. As you can see here, for the community, there's 55% of Idahoans 5 and older that are fully vaccinated. The national average, meanwhile, is 71%. Now, Dr. David Pate, retired CEO of St. Luke's Medical Group and a member of the governor's COVID task force, says that COVID precautions are still important and can be molded to fit current conditions.
I've talked to some people that say, "What are you saying? I need to wear a mask for the rest of my life?" No, I'm not saying that. I'm saying get vaccinated, get boosted when you should be, and then when there's low levels, make your decisions. And no, you don't have to wear a mask to everything. But when you're in a situation like we are, when even the CDC is saying that we're at high levels, understand CDC completely changed their guidelines. If we were using the old guidelines, we would have been in red a long time ago. So the fact that we're hitting red now, there's a lot of COVID out there. These are the times when we have high levels of transmission. That's when you need to say, I can wear a mask for a couple of weeks. I can wear a mask for a month. But if you decide not to, you decide not to. But everybody that wants to protect themselves, they ought to be aware that we are having high levels of transmission right now.
With that said, medical experts recommend masking and distancing as well as getting a vaccine. Are we all tired of the COVID and COVID measures? Well, many people are, and experts totally understand that. It's part of the human conditions. But they say, use a mask in crowded indoor settings and packed outdoor settings, things like concerts that you really get packed in. Doug, Dr. Pate and I talked about there being a lot of fun things to do during the summertime, and that's great. But the expert advice is still that we have high transmission of COVID in a lot of our communities. Do whatever you want with that advice, but the experts who know what they're talking about say that this is a time to maybe pull that mask out again, especially if you're going to be in a crowd.
Yeah, at least a lot of these big events are outside.
And that is good news.
That does help. Yeah. All right, Joe, thank you.